I now give the floor to the distinguished representative of Sri Lanka.
Mr. President, let me thank you for creating this platform to discuss the progress made and to review the challenges ahead with regard to the 2021 Political Declaration on HIV/AIDS. I believe that this would give us the impetus to reassess the progress made and to determine the roadmap towards the ambitious goal of ending AIDS by 2030. Mr. President, ever since the first known case of HIV/AIDS, we have found ourselves in a race to eliminate this threat to public health. In addition to the biological complexity of this virus, the severity and the danger of this virus came from its social repercussions and the reception as it unequally affected marginalized communities from the early stages and the social stigma surrounding its transmittance. While reiterating our commitment to the 2020 Political Declaration on AIDS and to the precedent declarations in 2001, in 6, in 11, 2016, Sri Lanka is of the view that there is a need for a volume of work to be done to achieve the progress envisioned in the 2021 Political Declaration. We believe that eradicating HIV/AIDS not only requires scientific answers, but a substantial amount of practical work and holistic policy approaches involving a cross-section of the society, including the state leaders, civic leaders, youth leaders, and the persons affected by the disease themselves. Action on AIDS has been truly transformational for public health. AIDS has also introduced a new paradigm for the involvement of affected individuals and communities and changed the dynamics between caregivers, the pharmaceutical industry, public health establishment, and international organizations, and affected communities. Arguably, the most extreme public health issue of our time, AIDS, has underscored the imperative to think and act beyond the confines of the classic public health arena, adopt comprehensive approaches, and engage leadership at all levels, even in presenting our response to the pandemic. Building on the early history, my dear friends, of political action around other health issues, the experience of the AIDS response, both the good political action as well as the challenges of bad politics and denial, has important lessons for public health, for the public health community. Early engagement of political leadership at all levels is without doubt essential to effectively address significant public health issues. Alone, it cannot ensure an effective response, but in combination with community mobilization, a public health apparatus, continuing economic development, and innovations in science, it can help to bring about advances in even the most challenging health issues. Mr. President, it is well known, and it is a well-known fact, that a public health threat bears no consideration of gender, race, or ethnicity. As such, it is of paramount importance to mobilize the global efforts to implement the commitments contained in the present declaration and thereby to bring the AIDS-related deaths to under 250,000 by 2025, generating progress towards the elimination of all forms of stigma and discrimination. Mr. President, the National AIDS Control Program of Sri Lanka is carrying out a commendable task in Sri Lanka in the context of coordination and coordinating the national response to HIV and AIDS in collaboration with the national and international stakeholders. Due to its coordinated efforts, Sri Lanka has been able to achieve a 57% reduction of the new cases and a 56% reduction of the AIDS-related deaths compared to the 2010 baseline. Sri Lanka has eliminated the vertical transmission of HIV and congenital syphilis beginning in 2020, and there are 0 cases of mother-to-child transmission of HIV since 2017. As of now, the number of new cases reported annually is below 200, and the adult prevalence 15 to 49 years, the rate is less than 0.1%. Mr. President, the theme of the 2021 declaration, ending inequalities and getting on track to end AIDS by 2030 itself is challenging, as the whole world is currently building back better from the impact of the COVID-19. The priorities of the countries have changed, and so were the allocation of their resources. Therefore, the inequalities are prone to occur, and it is incumbent, I say, upon all the nations to maintain the course and be on track to a successful realization of the 2030 agenda. We must appreciate that times have changed. The political will is one of the things most vulnerable to change in the AIDS response. Resolutions such as the United Nations General Assembly Declaration of Commitments on HIV/AIDS were made when the right elements came together. The document is still there, and the pledges still stand, my dear friends. But the political environment continues to evolve, and a constant process, I say, of revitalization and coalition building will be required to build and sustain an exceptional response for many decades to come. I thank you. I thank you, Mr. President.
I thank the distinguished representative of Sri Lanka,